Are you able to hear me now, Katie? Can you hear me now?
Try again.
I can hear you. There we go. I can hear you now. You can hear me?
Yes.
Perfect. Okay.
Okay. Hi, Katie. I'm assuming you can hear me too.
Yes, Dr. Rad, I am able to hear you. I am not able to see you.
Okay, they were saying you had to give me video access or
I
something. Was it?
did give you video access. You should be able to start your video now. If you were not able to, definitely let me know.
Okay, so it says and that's what I'm saying. It's saying it's like it can't detect my camera. Do you think I should log in and out real quick again?
That might be good.
That isn't. Okay, hi Katie. It's just saying that I can't detect my camera, and I was using it yesterday, so let me see why I have gotten turned off. If not, I'll have to use Zoom on my phone, which I was hoping not to, but we have a backup, not to worry.
Alrighty, excellent. We love a backup. We have lots of those running on our end as well.
Okay, so just give me 1 second because it's looking just testing fine. Why it's not. Mm. Can I detect your camera? Please show the connection and try again. Very weird. 1 second.
Okay.
It's not something that you have to give me access to for some reason.
No, I did at first, but I have given you that access. So you might want to click the little arrow down by your video, where it probably says stop video, and check and make sure that it is the correct camera that's selected. So for me, it's the FaceTime camera in my computer. You might have a webcam hooked up.
Yeah, it's mine is like the FaceTime one also, but the weird thing is that it doesn't even let me pull up that menu. You know what I mean? Like it does for the headphone, for the
Okay,
microphone.
it's not letting you pull up that menu. That is interesting. All right, let me, you know what I'm gonna try. Nikki just pasted steps to you, and I'm looking to see if I can do anything on my.
Settings for Zoom to access the camera. Open the device settings, type of applications or apps. Tap Zoom. Apps over Zoom settings. Zoom. Wait, no. Oh, accessibility.
Participants over here. More. Yeah, I have panelists can start video. I'm gonna attempt to.
Okay, I'm gonna give this 1 more minute. Maybe you could remove my camera and then re-give it back to me.
Yeah, you know what I'm going to do is I'm going to try to make you the host and see if it'll let you do it that way.
Okay.
All right, you're now the host. Did that change any settings for you?
No.
Huh.
Admin. Right. Okay. Then I might just.
All right, I'll take host back.
Video. It just keeps saying cannot detect. It has to do with this, I think. Open the device settings, applications, or apps tab, Zoom. It does not list access. Okay, so let me see if it has to do with the browser. 1 second. Okay. Let me try one last thing. If not, I'll just go for my phone.
Okay.
Design camera options. Okay. Okay, going to accessibility camera options. You know, people are waiting.
That is okay. We appreciate everybody being patient.
Camera. Allow the applications below to access your camera. So it does say that. Will access your camera until it quits later. Quit and reopen later. Supposed to have access to it. Will not have access to your camera until later. Huh. Okay, what I might have to do is close the browser. Okay, one last try, and then we'll go to my iPhone.
Okay. Thank you, everybody, for your patience. We will be up and running with you shortly. Gotta love technology. It gives us access to these incredible speakers and also gives us little bits of headaches. All right, while we're waiting for Dr. Rad to come in, I will go ahead and tell you all, if you have questions, drop them in the Q&A box. There is a Q&A box at the bottom center of your screen. It just says Q&A, and that will be the easiest place for us to keep track of those and make sure that they are coming in well. And those questions can be about our subject. They can be for Dr. Rad. They can also be about the summit. And I will wait until Dr. Rad has finished his talk. And then I will give you answers to any of those questions that are specifically summit related. Okay. Excellent.
Okay, here we go.
There we go. All right. Thank you so much for being with us. I am going to go ahead and just do a quick introduction so we can get started. We appreciate you, Dr. Rad, so much taking the time to be here with us and share with us today. Dr. Steve Rad is a highly specialized international expert in obstetrics and gynecology, maternal fetal medicine, and high-risk pregnancies. He is amazing. He is double board certified and has undergone rigorous training with highest honors at so many prestigious institutions: the David Geffen School of Medicine at UCLA, University of Southern California, Cedars-Sinai Medical Center, UC San Francisco Medical Center, as well as internationally, including in places like London, Israel, Austria, and Africa. He is a renowned researcher. He is well published and actively involved in so many medical societies and medical research, but he also has a passion for teaching all of the things that he knows to get as many amazing OBGYNs out there for us to serve us as possible. He served as faculty at the University of California at San Francisco Medical Center, and he's currently on the teaching service at the renowned UCLA and Cedars-Sinai Medical Centers. Dr. Rad is consistently selected as one of the best maternal fetal medicine specialists in Los Angeles. He has been voted among LA Magazine's top doctors and Southern California's rising stars almost every single year. And one of the most exciting things among that list of accolades to me is that he was recently recognized. His entire clinic just got certification as a rainbow clinic, one of the first places on the West Coast. Actually, I think the first place on the West Coast is that, yes, the first rainbow clinic on the West Coast specifically certified to serve and support patients who are going through pregnancy after loss. It is such an honor to have him here to talk to us about patient empowerment today. Thank you so much, Dr. Rad, for joining us.
Thank you very much for having me and for the honor, and thank you for your beautiful introduction. I was, coming today to speak with everyone regarding empowerment and their pregnancy, both high risk and low risk. So as Katie mentioned, I am a high risk pregnancy specialist. I take care of both low risk and high risk pregnancies. And yes, we most recently launched our official Rainbow Clinic here in Los Angeles. So first in the West Coast and the second in the country. And it's modeled after the Rainbow Clinic, which originally started in London. So for us, advocacy is very important and empowerment is very important. And so today I just picked, for our short talk, I just picked 6 important things I thought would be important for our followers to help empower them in their pregnancy and help with advocacy and for advocate for themselves and to have the best outcomes and to have a pleasant and a positive experience in their pregnancy. And as we discuss them, you'll see it's all about planning and planning your pregnancy. And if you're already pregnant, it's not too late, not to worry. But the sooner you plan things out and have various important things in place, I think the better your pregnancy experience and outcome can be. And I'm not sure if everyone's familiar with your organizer, the pregnancy and newborn baby planner.
Yes, Dr. Rad is actually medically reviewing this for us right now. And also, Dr. Rad, there's a little bit of a gurgle when you're talking, like every few words, we get a little bit of a sound. We might try it without the headphones. I'm not sure.
Okay,
it's
sure.
A speaker issue.
It might be a Bluetooth thing, so I'll change that now. Okay, let me just get rid of those. Let's see what happens.
So we can't hear you right now.
How is it now?
Perfect. Much better.
Great. Okay. Yes. Sorry about that gurgle. Okay. So as I was making my list, I guess it made me come back to this, your baby planner and how important that is, because it's interesting. As I was saying, of empowerment and advocacy, it's all about pregnancy and newborn baby planning. So in terms of feeling empowered, I think if you plan your pregnancy carefully, either before you become pregnant or as soon as you find out you become pregnant, as carefully as possible, and have everything in line that follows your wishes and that's a good fit for you, then you will feel more empowered and have a safer pregnancy and better outcomes. So the first thing is that you want to make sure that you and your provider are good a good combination. What I like to call it is the patient physician or the patient midwife partnership. So your pregnancy and your provider, you are a partner with them. And I think most providers feel that way and would appreciate and want to feel like they're partners with you rather than, you know, than having like being against, obviously not being against you or them just telling you what to do. They'd rather have a partnership and make shared decision making with you throughout the pregnancy. So you want to make sure you and your obstetric provider are on the same page. You make sure that you have a provider that cares for you, that you get along with, who's reachable, you're able to communicate with them, that they're available, and that they have the correct level of competency for your conditions. You could be low risk or high risk. And you want to make sure you bond with them well. Okay, so sometimes this requires a little bit of research. You have to ask friends, ask colleagues, ask other providers for referrals. Sometimes you're able to do meet and greet with your physician or your midwife and see if they're on the same page as you, or you go in and meet them and tell them that your concerns and questions and how you want your pregnancy to go. And then you want to make sure that you visit their office, meet the staff, make sure that the staff is friendly, and that you're a good match with everyone. And then you want to test the system. You want to make sure that your provider is reachable, especially during emergencies, and that they're open to communication. So you can test the system. Just call one day after hours and page them and see if how soon and how quickly they respond, and if they're giving you the correct level of response that's adequate for you, and that they're taking your concerns seriously. And there are some I think truly all providers want to give the best care, and some are more available than not. And it depends on the community, depends on the center they're working for. And sometimes it's out of their control. It's not that they're a bad physician or a bad midwife. It's just out of the system that they're in. So you want to make sure that you have the best partnership with your provider. So Katie, I just wanted to stop there and see if you had any questions or any follow-up comments regarding that.
Absolutely. I think my biggest questions would be so I personally have changed providers mid-pregnancy because I didn't feel like I personally was being a central part of my medical team. They didn't want to listen to my opinions as much. So I'm curious, in a world where doctors are so overextended with their patient loads and they don't necessarily have the time to give to the patients that they would like to give to them, what can we do? Particularly, for me, it was easy. I live in a large city. I said, I don't like this doctor, I'm going to find another doctor. And I was kind of able to doctor shop. But for people who maybe they live in a more rural area and they don't have those options, or maybe their insurance networks make it where they really don't have a ton of different choices where they are there any things that we can do to try to get those more reluctant doctors a little bit more on board with letting us be part of our own teams?
Okay, that's a great point, because like you said, sometimes it's not an issue there's a limitation of where you live, or again, system issues like with the insurance or what time the provider's been given by their institution to spend with you. So in those cases, I think it's best to speak with the provider and say, I really want us to be like a team and a partnership. I know there's some constraints that you have within the system and your availability. Is there someone what would you advise? What's the best way if I'm really concerned to get in touch with you? Is there someone in the office who can help with some of my questions I can go to first, so that I'm not it's better to get some kind of answer and some kind of help than no answer if the doctor's unavailable. So I think what I would do is if you're in a situation where you have limited options, I would try to utilize the staff and ask the physician to put you in touch with, or have as part of your team, a staff member kind of assigned to your care if possible. And usually that could be the physician's medical assistant. They're very familiar with what advice the physician gives, or they can quickly have access to the physician or midwife where they can get questions asked for you. So I would become friendly with the staff and use that as a as a as a means in order to partner, and that's better, because also I really feel like if you have a good relationship with the staff, it's in a lot of ways even more important than with the physician, because they're the kind of the gatekeepers of relaying any concerns or messages you have, and sometimes they're in place they're the ones available to take care of anything. It could be something as simple as a prescription versus something more serious where you have a concern and they can run and get the doctor. So I think it's in those cases where you're limited to a certain provider and limited to a system, whether it's because of you're living in a rural area or your insurance network, then I probably would utilize the staff and just be very upfront with the physician. The point is to not be sort of defensive or at odds with the provider. It's to really convey to them that you want a partnership and make a team. So if you're asking questions, it's not because you don't trust them or you're making a big deal of this whole partnership thing. Is not because you're too demanding or not. You want to actually make their life easier and for them to feel also more comfortable so that you're partners in the care. And I think that would also help diffuse the situation. You never want to approach them like you're questioning them or you're offending them. You're actually trying to make it easier for them as well.
I think that's such an important point, and I appreciate you bringing that up, because I think as patients, that's one thing we probably don't recognize, that sometimes our plethora of questions, particularly if we're prone to anxiety or we're pregnant after loss or infertility, if there are reasons that we have more concerns, it could easily come across as though we're questioning their opinion when they're expert and we are not. And I think that rhetorical stance is really important, that we show we want to be a central part of this care team. We want to make sure we understand, but we're not asking these questions to undermine your authority. We're asking because you're the person who we have to trust.
Right. And so exactly. And so I think using that term partnership or team really helps get the message across.
That's so helpful. Thank you.
And you can say, and again, I know you're busy. I'm willing to work with one of the staff members, because sometimes even in my office, like sometimes the patients only want to talk to me or only want to see me when I have 5 people I've trained to be able to take care of those things in case I'm not available. And the staff, the girls have been with me for like 5 years. They know what to do. They know exactly what I say every time. I trust them, and they know, or else they wouldn't be here. And I know they can handle it. So I would love for the patients to feel comfortable with everyone in the office as well. And so yeah, and it just reminded me, becoming friendly in general with the staff is very helpful, and they like to feel appreciated and like to feel part of the team as well. And so I think that would go a very long way. Sorry to say this, but you don't have to, but if you bring like cookies, for example, or just show that you're on the same team as the staff and the physician, it really goes a long way. Because we're used to a lot of patients becoming like they're trying to say that they want this, but they come with a kind of an offensive or hostile approach. Anyway, so I think if you really personally and truly mean it and come with a team and partnership approach, it's very, very good. So that was our first topic, was to find the right provider for you, and making sure you're on the same page, you get along, they're reachable, you guys can communicate with one another. They can provide the level of care you like, and you're bonded with them and their staff. You've asked friends, you test their system after hours, make sure they're reachable. And if they have any concerns, you have your open book with them and you make a team and a partnership with them, and you find a good match. In the instance where you're limited to certain providers because you live in a rural area or because of your insurance network, then we were discussing that there's ways around working with the provider and with the staff in order to make the team that you want. And if you come with love and kindness and honesty, I think you can totally do it even in the most difficult situations where the resources are limited. So that was topic number one. And we brought up when it was gargling, the organizers, this is how we met Katie in Undefined Motherhood when we got this planner and we wanted to get more involved. And she gave us the honor and invited us to speak at the summit. And we hope to we're working on reviewing it and adding some things, but it just, as I was coming up with my 6 points, I wanted to talk about, it comes all back to the planning your pregnancy from the beginning. So for those of you who are not pregnant, it's not too early to look for the right provider from now and have that in place. Number 2 is once you meet your provider and you've established your pregnancy, or even beforehand, so we recommend, when I keep saying before, and we recommend like you can do a pre-pregnancy or pre-conception counseling session where you meet the provider ahead of time. Whether you're pregnant or you're doing a pre-conception, you want to plan and understand your pregnancy. I think this is the second issue in terms of empowerment and advocacy. You want to plan and understand your pregnancy and play an active role in the process. So you want to ask questions. From the beginning, you can ask the doctor or midwife, what is a pregnancy plan? You can bring a calendar or your planner with you and write down what your pregnancy plan is. So what is their typical appointment visits? Which weeks are they going to see you? Which weeks do they do what blood tests? What genetic tests are done? What the milestone ultrasounds are that they do? How often will you be seeing them versus going to the lab, or all those done at the same visit? What happens if you have a low risk or normal pregnancy versus a high risk pregnancy? What happens if you're low risk and it becomes high risk? So I think if you plan and understand your pregnancy from the beginning, and if it's not already in the book, we would like to add a section about that. But you can just bring a calendar with you, or a piece of paper you're gonna go through. Next, we're gonna talk about birth plans, but like a birth plan in what you want done in your birth, there should be a pregnancy plan, and you can have the pregnancy plan filled out with your doctor. Maybe we can make one together. But so I'll just reiterate those things. You want to ask questions. Know what your pregnancy plan is, so that includes how frequent your visits are, what your visits are, which ultrasounds you'll be getting, what genetic testing you'll be getting, what blood tests you'll be getting, what happens in a normal pregnancy versus a high-risk pregnancy, and what if a normal pregnancy, or what we call low-risk pregnancy, becomes high risk? What will change, and what does that mean? So you want to plan and understand and play an active role in your pregnancy. Okay, so we'll stop there to see if you can ask any questions.
If anyone has any questions as Dr. Rad is talking, please just pop them into the Q&A box at the bottom. I feel very clear on this one personally.
Okay, so I don't see anything in the chat box, but with that said, one thing to know about for the pregnancy plan, just kind of a general outline. You generally meet, depending on your provider, you'll meet them anywhere between, sometimes the beginning it has to be weekly, then it becomes every 2 to 3 weeks, and then sort of monthly. The best, safest trimester is the second trimester, and then the third trimester visits become a little more frequent. Maybe they'll become again every 2 to 3 weeks, and towards the end it's every week. The beginning, you'll get some blood tests and genetic testing, and most of those are done in the first trimester, and then you have one test you do in the second trimester for spina bifida. Your third trimester or early second trimester, you do a diabetes score. For ultrasounds, you generally do an ultrasound in the first trimester for dating, and you're going to do an early, what we call it, anatomy or genetic ultrasound in the first trimester. You do the big ultrasound around 20 weeks of pregnancy. It's called a fetal anatomy ultrasound. And sometimes in the third trimester, you'll monitor the baby's growth. If you're high risk, you'll be getting a lot more testing and ultrasounds done. But one thing I do when I first meet with our patients, we kind of lay out their expectation and we plan the pregnancy. We make what's called a treatment plan from the beginning. So from the first visit, they already have a pregnancy plan, just like you have a birth plan of when their visits will be. Okay, the next thing in terms of empowerment and advocacy is what to do in cases where you have symptoms or an emergency. So you need to have a plan in place, talk to your provider. What happens if you have chest pain or shortness of breath, vaginal bleeding, leakage of fluid, contractions, or the baby's not moving, or high blood pressure, or your blood sugars are out of control if you have diabetes, if you have any sort of other symptoms, any other concerns, what do you do and how do you get help? And so first of all, you need to speak up for yourself. The first part of this is if you have those symptoms, not to hide them or just act like they're normal. If any time, there's no, we say what our motto is like, there's no question or concern that's too small. So the first person is responsible is you to speak up, actually, and you need to advocate for yourself. So if you're bleeding or you're leaking fluid or we're supposed to get a blood test you didn't hear back from, or you never heard about something you need, like so many times I meet patients, I'm like, what happened with your diabetes test your doctor did, or what happened with, and then they said your spina bifida test, and they just say, oh, I never heard back. Or was your pap smear normal? They say, I never heard back. So I assume no news is good news. But why make that assumption? Why not just call the office and speak with a medical assistant, and they can tell you sure, no news is probably good news, but maybe not. Maybe it just got lost, or there's some delay, or they never even got the result from the lab. There's so many times where there's lab errors that has nothing to do with the office, or something was processed, so they never got it. So there's no news because they never even got news. So that's where, again, having a planner and writing things down and having the birth plan so you can check things off. Okay, so where is my diabetes results? And you don't always need the doctor. They don't have to call. You can call them and just ask. You don't need to even talk to the doctor. Just say, hey, again, you remember in the beginning, you should have made a partnership with one of the medical assistants or the entire staff, if not the entire staff, at least one of the medical assistants, and make that your point person. So you call them. So in our office, it's often like Brittany or Larice. So you'll call them and say, hey, Larice, what are the results of my diabetes test? I didn't hear back. We text our patients, but honestly, sometimes we even get busy and labs pile up until the end of the week. And this depends on the week. Sometimes we're really good. They came the day before, the next day we gave them the results right away. And sometimes it's not till the end of the week. Or sometimes the patients will text us and say, oh, I got the results on the lab portal. Can you please tell me what they mean? Anyway, so, and whether it's symptoms, bleeding, or contractions, or whether it's lab results, you want to ask for help. So it starts with you. Not a lot of times we're seeing people blame the providers, and it's true, they should also be following up with you, but why not you be a partner with them and help them out because they're so busy. So, and again, they're busy. One more thing I want to say, so there's this connotation that they're busy because they're trying to make money or they're trying to see too many patients, but the problem is, unfortunately, sometimes there's just a large volume of patients. They're one provider they're responsible for, and sometimes those decisions aren't made by them. I'm sure every doctor or midwife would want to have like 5 patients at a time and that's it. And sometimes it's not feasible because of the job that they're in or the city they're in or the position they're in. So it's not necessarily them, or it's the insurance system they're in and all that. So again, make it a partnership, make it a team. By you empowering yourself and advocating yourself, you're actually helping them. Okay, so we want you to call and ask questions, get your lab results. If you have bleeding or you have leakage of fluid, the baby's not moving,
you can call your provider, or you can just go in and go into labor and delivery. So you want to know where labor and delivery is, where to park. We have like a map, and we show everyone where, as part of like the beginning planning, we tell them this is the hospital. If you come in, if there's an emergency, you go to the ER before 20 weeks. After 20 weeks, you go to labor and delivery. This is where you go park. And they have like a map of the hospital. So you want to plan those things ahead of time. The biggest thing is if the baby is not moving, or you have some bleeding or leakage of fluid, not to be scared to speak up and ask for help. So especially for women with pregnancy after loss, or why wait to become a pregnancy after loss family, so to speak. If you feel something's wrong, go in and get help. You don't even need to call your provider. You just go to your labor and delivery or the nearest hospital. It doesn't even have to be your hospital. And you don't leave until they make sure the baby's okay and you feel the baby moving again. And if they tell you to leave, you go to the next hospital until you're satisfied. Anyway, so the point of this third topic was to ask for help. Don't hide or assume things are normal. It goes back to making that partnership and team from the beginning with your provider office. And even if they're not available, it doesn't matter. You just go to the hospital and get help. And if that hospital is not providing help, you go to the next one. You refuse to, or you keep going if you have to, or you just refuse to leave until, because they can tell you the baby's moving, everything looks good, but you still don't feel the baby moving. You should still stay there for monitoring.
Absolutely. I am so glad you mentioned this, because this is something that comes up a lot. People will send me a message on Instagram and they'll say, hey, this is what's happening. Should I call my doctor? And I want you to always know you should call your doctor. If you are ever wondering if you should call your doctor, you should call your doctor, because that's what their after hours lines are for. That's what their nurses or physician assistants lines are for. They're there for us to call and to ask questions. And I noticed that I am much more ready to call my children's pediatrician after hours than I am to call my OB after hours. And that's just a symptom of how I have been trained to put myself and my needs last. Call your doctor. Call your doctor if you have a question. And also, one thing I would add to this is when you're asking for things like test results, have them send you a copy through the portal so that you can see them. I had a very crazy experience during my last pregnancy where they called to give me my NIPT results with my genetically normal girl a week after I had been told I was having a genetically normal boy. And it was because I had called to check the results because they had not called me. And the person I spoke with didn't double check my birthday, and they gave me the wrong person with the same names results. And it was very upsetting. But also I realized if I had just had them email it to me, they would have been more likely to catch the date discrepancy. And I would have been like, hey, that patient's not me, as soon as I looked at those results. So I think when we're talking about this, you're being part of a partner, you're being part of the team, being able to just say, hey, let me glance and make sure everything looks right. I know I have the results. I've seen them. You're going to catch more things and be more empowered when you have all of that information in front of you.
Yeah, absolutely. And actually, it's helpful because patients nowadays can review their results and they can interpret it or have a copy in case they go to the hospital. It helps out tremendously with referrals. Like if you go to the hospital, and you have your records with you, it actually helps the provider's office. They don't have to sit there and fax everything all over again. You just have it on your phone.
That's such good advice.
It's actually not a bad thing. So we try to email and text results to the patients as much as possible. And then they're welcome to do their own research. And then we know that they have it firsthand, just like you said. So we totally support that idea. Okay. So I'm just did a little pause because when my patients texted me and she needs a refill for her insulin. I can't show you my phone directly, but anyway, the patients have our phone and they text us. So I was just making sure it's not an emergency. Okay, but that's an example. And they know they can text us anything. But yeah, this morning, like someone's NIPT came back and I didn't want to give them the sex. So I blurred out the sex part and then texted them the results because they started asking, well, what about all the genetic results? And then I'm like, because the NIPT comes it has the genetic screening results in addition to the sex. So I just blurred it out and sent it to them, and they can sit there the rest of the day interpreting it, and they can ask me any questions they want. But they feel, instead of me just saying it's all normal, they can see it for themselves. And I have it makes my life easier. I feel more comfortable and having them be a part of it. By the way, I think I went way over my time. I hope that's okay.
It's completely okay. We're so happy to get to learn from you.
Okay, good. Okay, so then, yeah, before I moved, I just wanted to make sure in the case of emergency, was it clear, Katie, what to do, and particularly if like there's fetal movement or bleeding issues. So before I move on to that, you're welcome to call your provider, but if you can't reach them or it's after hours, there really is no reason. You can make a plan with them ahead of time. If I have bleeding, if I have leakage of fluid, baby's not moving, headache, high blood pressure, what do I do? Just have a plan ahead. Plan is that you go to labor and delivery, and you don't take no for an answer. Okay. And there's nothing wrong with it. If you go there and everything's fine and they send you back, but at least now you know what labor and delivery looks like. You've met the staff there. And it's also important to have a good relationship and partnership with them as well. Okay, so that brings us to the 4th out of 6 topics. The 4th one was childbirth and having a birth plan in place. And plan for what you're going to do during the birth. So we think a birth plan is very important. There's many birth plans online. I don't know if there is one in your book.
There's a really short one in our book, just so 1 page, all the basics.
But it goes into like what to expect and all that. So what we do with our patients, no, I like it. You have like a to-do list and stuff. So what I do with our patients is they have a childbirth class in the 3rd trimester where we have a labor and delivery nurse who does like a 3-hour course, and they go through all of the different childbirth scenarios, whether you're doing a natural labor or an induction of labor or a C-section or in case of emergency. And they go through what happens when you go to the hospital, where you're going to park, what to bring with you, what bags to bring with you, what to put in your bag, where you're going to park. Then they go through your birth plan with you about IVs and medications and what to expect if you're natural versus being induced versus C-section. They talk to you about having a support person with you, whether that's your partner, a family member, a friend, or a doula. Then they talk to you about the actual birth part and how you're going to push or what to expect in that situation. Or if you're in a C-section, it could be scary and what to expect in that situation. They'll talk to you about epidural and pain medications, really just what to expect every step of the way. Who your visitors will be, what you're gonna do, if you can do a tour or a test run of the hospital beforehand. Some people choose to do like cord blood collection to have that, and that's the cord blood kit in place. And what records to bring with you when you check in. Like you want to know your bacteria status, your GBS status. Anyway, so we have you meet with a nurse. There's childbirth classes online, or there's local childbirth classes, or maybe your provider has someone that they recommend. But we definitely think you should have this part down, a lot as well. So we think everything in your pregnancy should be planned, as if you're catching the theme here. So we want the actual childbirth and all the things that happen, whether you're going natural or induced or getting a C-section, to be planned ahead of time. And so when our patients take this 3-hour course with our nurse, who's been a labor and delivery nurse for like 30 years, she brings all these diagrams and explains the pelvis and the dilation and all the medications and what they do. Our patients tend to go to labor and delivery and have 0 questions. They don't have questions for me. They literally have no questions in the office for me. When they go to the hospital, they have no questions from the nurse. They already know what medications and what order are expected. They might get their water broken either naturally, or we might have to break it for different reasons. They already know what they have, their bag prep, they have their support person in place. If they have a doula, they let us know. They can which medications the baby is going to get or not. So they really have everything already planned, so that when they go there, there's no questions asked. And I compare that to other providers' patients. Sometimes they go there, they refuse medications because they never heard of it. They didn't know their water needs to be broken in case of an emergency. Then they're refusing that in the middle of an emergency. They didn't know certain blood tests are going to be done, or what medication is going to be, what exams going to be done. They have no clue until they get there. They're very nervous. They don't know how they're going to push and all this stuff. So we really recommend at least one childbirth class, and it doesn't have to be multiple or for weeks or anything. She does this all in 3 hours, to plan the actual birth part. And we hope that when you go there, you have 0 questions and you've gone through every single scenario, and it makes it very pleasant. I have had patients who've had scheduled C-sections, no questions asked. They've had patients who've been induced for 3 to 5 days sometimes. They really wanted a vaginal, so we waited and everything was safe and within guidelines, and we waited and waited. And I swear during those 3 days or 5 days, I had 0 questions. So this part of being empowered and advocacy is very important in terms of your actual childbirth. And we want you to have, again, we'll have like these checklists, and what in your book you have like what should be in the hospital bag and whatnot. And we're trying to make some things longer. And you have so much things, what to expect, what medication. It's all, a lot of it's already in your book, but we want that part to be very clear ahead of time. Okay, so we'll stop there and see if you have any comments or questions, Katie.
Yeah, I think that's such an important point that you're making. And I love this idea and the reminder to not only to make the birth plan, but to go through it with your provider and have to know what you're going to expect. Because as we all know, things might change, but so often we don't know what medications we're being provided when we go to the hospital. We don't know what's going on in our own care. And if we have talked about these things ahead of time, that supports your provider in taking better care of you, and it supports you in understanding what is going on. Just a really simple example, when I was being induced with Jack, I had preeclampsia. I was going in for induction. I said, "What are you going to do to induce me?" My doctor said, "It depends on how things look when you get in, but the most likely scenario is that we will give you Cytotec and night, and then the next morning we will start Pitocin." And I was able to say, "Hey, I actually am not comfortable with Cytotec. I have a history of recurrent miscarriage. That medicine has really bad triggers for me. I want a different option." And I could have said the same thing in the hospital, but it would have been a lot harder to say it in the hospital when there's so much going on and I'm more confused and my adrenaline's pumping. It was really nice in that moment to be able to have that conversation ahead of time. I did not do as good a job with that with Branham. And if I'm being honest, the hospital scenario is much blurrier to me. And there are things that really didn't get communicated to my medical team, even though they were in my birth plan, because I never had that earlier conversation. So I think that's such an important point, not just to make it, but to have that conversation about it. I think that's a step so many of us miss. We think, oh, we'll give it to the L&D nurse and we'll talk about it, or they'll read it. But really having that conversation with your provider before you ever go to the hospital is really the right time to start it. And then you take another copy of it with you to the hospital to give to your nursing staff.
Absolutely. Okay, that's perfect. Yeah, I just remembered a patient. She learned about for similar story. She didn't want Cytotec for the same reason, and so we had that in the admission orders that we were going to do medication Servadil instead. But the point is, we talked about it beforehand. So when she got there was no issues. No one had to get an argument with her about, oh, we always do Cytotec. Why are you getting another medication? It's all pre-planned. Okay. So number 5 is mental health, perinatal mental health, which is very, very, very important. So pregnancy can be a very difficult time, both for the pregnant woman and the partner or the support person or the family. And so we think it's very important that even if you think you're okay, to have some sessions with a mental health specialist during your pregnancy. And we don't have this yet with our patients, but we're going to be having all of our patients offered. They can always refuse, but offered a pre-plan where they'll have at least 2 sessions or a workshop with a psychologist who during the pregnancy, and also at least 2 sessions after. There's a lot of changes that go on, especially in a first time pregnancy, or why not even in a second time pregnancy if you have another child to deal with, so there's a lot going on in terms of mental health and anxiety and stress, and sometimes you feel depressed or you're just crying for no reason you don't understand. Sometimes your partner, support person, or family doesn't understand. And so we really think it's important to either have individual sessions or group sessions with your partner or support person during your pregnancy. And as part of it, feeling empowered and advocacy for yourself, I really think it's important. People don't know, the partners sometimes, the woman's sort of personality or stress level changes, and then the partner doesn't know what's going on and retracts, or they get into a fight, or the partner becomes very kind of quiet or timid and doesn't want to say anything because they think whatever they say they're going to get in trouble. We hear all kinds of funny ways they explain it. So a lot of the men feel kind of helpless, or they feel like whatever they do is going to get them in trouble or cause stress, so they just stay quiet. And then in turn, the pregnant one feels like the partner's not being supportive, or not reading their mind, or not understanding, or not wanting to be helpful, but they just don't know what to do. We see it especially after the baby's born too, where the partner or support person is not playing an active role, and then the mom says, oh, they should just read my mind, they should just jump in and help, but they're scared to because they don't want to do something wrong or make you upset anyway. So we really think the point is that it's very important that you have a check-in with a mental health specialist. There are not many, unfortunately, perinatal mental health specialists, but the good news is you can do them virtually even if they're not locally available, and they're not very expensive, or sometimes can be covered by your insurance, or you can do the workshop that includes multiple couples, so it's cheaper. And to take your partner, your support person with you and have an open conversation. You can also do individual sessions. You may think you're okay, but there's a lot of changes happening, and maybe you think okay, not trying to be rude, maybe some of you are okay, but a lot of you are not okay and you don't know that. Or you think it's the partner's fault or whatnot. So, anyways, I think if you really want to have a wonderful experience, we really advocate to have a mental health counseling. And so what we're gonna do, I just spoke with one yesterday, because of a patient, a lot of patients just come in and just crying for no reason. Or they say, I don't know why, I'm just crying. And so we give them support and reassurance and just say, oh, it's normal. But then the truth is they really need to see an expert, instead of us kind of brushing it or just giving them reassurance. And then sometimes I see the partners come in the beginning and then they're missing like the rest of the pregnancy and they're at work, and who knows, maybe they're just really working, or maybe they're retracted a little bit. So what we're going to be offering soon, we're working on like a once or twice a month workshop for couples. Or if you're having, it's a lot of patients are singles, they can do it alone or have a support, whoever is going to be their support person later, attend and have these sessions built into their prenatal care, both pre-pregnancy, sorry, during pregnancy and postpartum. And actually, you can even start pre-pregnancy. Anyway, so I tend to repeat myself a lot, but I think I got the message hopefully across, and I'm sure, Katie, you have some comments about this one, about how very, very important it is. And especially for the first time moms, after things change a lot, going from being without a child to all of a sudden having a child, a lot of things in the family and your personal life change. And we'll talk about that a little bit about after as the next point. The postpartum period is my last point. So we think, you need to have this support system of the mental health specialists in place.
Absolutely. I 100% agree with that. And one thing we recommend, and if you're using my planner, you'll see this, is we suggest finding a perinatal mental health specialist while you're pregnant, and having that information already written down and programmed into your phone, and also having given it to one of your support people, because the hardest part is that initial outreach. It's figuring out that you need help and then figuring out, how do I find someone? So if you do that work before you need help, one, research actually tells us that you're going to be less likely to need support just because you have a plan in place. But two, when you need to reach out for that support, or if you need to reach out for that support, you don't have to do that emotional labor that can often just be too much for us when we're really struggling of trying to figure out who to call. You've already got that information. And we had already had one perinatal psychologist who spoke earlier in the summit, Megan McCutcheon, and I believe she's speaking maybe again tomorrow. So definitely keep an eye out for the things she's saying. Another great place to find the provider is Postpartum Support International has a provider directory. And so you can go and find perinatal certified psychologists or psychiatrists or counselors there. So I love this idea. And I love the idea of even already having an appointment scheduled. I did with my first. I had an appointment scheduled 3 days after he was born because I had an induction date. It was a little bit easier to know generally when that appointment needed to be. And I really thank God for that. I couldn't even get words out. I was just in hysterical tears, sobbing, and hyperventilating, and having already had that on the books and knowing like someone is it was even scheduled that they were going to call me for that appointment because I might not be in the place to pay enough attention to time and call them. And like, it really made all the difference. So I think this is essential and important advice.
Yeah, thank you so much, Katie. I can't tell you how many calls we get, either from the partner support person or the patient just crying or confused. They don't know what to do. And I'm regret that I didn't have the resources available so ahead of time. So I'm going to do just that. We're starting this month, where we're just going to automatically recommend and refer everyone for 2 sessions. And at least 2 sessions during the pregnancy and 2 after. And I'm sure they're going to go more, because once you go, I think it's very helpful. It's a little different than, I know some people are hesitant. I don't need a psychologist. Like, it's a little different. And then we're not saying you need one, or calling you, no one's calling you crazy or anything, or telling you you have to go. And it's different than when you're not pregnant and someone tells you, oh, you need to go get help. But yeah, they hate when you our patients tells, don't ever, like when the partner tells them there's something, you're crazy, you need to go get help. They're really not. So it's very different when you're pregnant, and it's normal. There's a lot of changes happening, and you need to, and it's great to have that as part of your team.
And the questions that you will get in conversation with a perinatal counselor are not the same questions you would get in everyday therapy. They're really very targeted to look for your specific needs, and often kind of leave me like, wow, I had no idea that I needed to think through and talk through that particular thing. And they are very plan, at least mine have been very plan oriented. They come in with very specific questions for me, and I walk away. It's not like I walk away from talk therapy, which I personally love and do advocate for, but I walk away with a plan to improve specific things that are struggles. And so it feels very active and very participatory and extremely supportive.
Exactly. Okay, thank you. You got those was what I was trying to say. It's not really talk therapy. It is very, very specific and very helpful for everyone. Okay, so that brings us to our last point. One thing that a lot of pregnant women are not prepared for is what happens after birth. What happens with yourself? What happens with your partner or support person? What happens with the baby? So you also likewise want to plan, plan things up front. You want to have a support team in place and identify who those people will be. You want to make sure you have adequate support. Know the signs of postpartum blues and depression. Have your pediatrician chosen, and sometimes it might be just chosen for you, or if you have options, sometimes they do meet and greets and you find similarly a pediatrician who's going to be accessible and reachable, and you like their team. And the same whole story we talked on from the beginning about being on the same page with them, and making a partnership with them. You want to have that in place with your pediatrician from ahead of time. And the pediatricians are used to people interviewing them, interestingly. So they'll go for like a 1 hour interview, and the patient will be like, I interviewed this pediatrician for 1 hour. I'm like, what the heck did you ask them? And I don't even know how they have the time, but they put the time in to do this with you, because they want to have a partnership, and your child's going to be their patient possibly for 10, 15, even up to like 18 years. Sometimes people follow with their pediatrician for many, many years. So I understand it's a long commitment. And so it's important to have that in place. It's important to know what milestones to look for in the child, how to feed, whether it's breastfeeding or bottle feeding, what you're going to do for sleep, sleep training. Other things are like disability forms, and how are you going to go back to work, and if you go back to work, who's going to help after that, what to do in case of emergencies, all different feeding options, how to use a diaper, what crib you're going to get, there's all these so many different options for strollers and bassinets and whatnot. And I think some of that is in the planner as well. And the most important part of this, the reason I talked about the postpartum part, is that you want to create, it's very important, you create time for yourself and self-care, and have some kind of backup support so you can have some time off. There are some moms that want to do everything themselves, and that's fine, but you need to carve out a little bit of time at least for self-care, and where there's someone that's hopefully available. You have some, whether it's your partner or family member or a nanny, or could be the neighbor, whoever is available. You have some kind of backup support so you can have some time for yourself. Because otherwise people have difficulty even finding time to go to the shower or bathroom or eat. I mean, there's some moms that don't eat all day until the baby's asleep. They're like, I didn't eat all day because I was cleaning and feeding and changing and the nap time, and then it's like 7 p.m. It's the first time they're eating something. So you want to have time for self-care. Is as important as all the things of taking care of the baby. So the theme here is that you want to plan as many things as possible. It might sound overwhelming, but if you have just kind of keep this outline in mind, it's totally doable. It's not too overwhelming, not to worry, especially if you have the planner. It's very helpful to organize those things. But to summarize, we talked about having the right patient and physician partnership. Then we discuss planning the pregnancy and just knowing like what appointments and blood tests and ultrasounds you'll get. Then we talked about what to do in case of emergency and asking for help. For example, if the baby's movements are off, if you have symptoms like bleeding, and where to go and how to get help. Then we discuss having a birth plan in place and knowing all the different parts of childbirth and different types of childbirth, whether it's natural, induction, or a planned C-section or an emergency C-section, having your support people in place in there and having a birth plan and what wishes you have for that. And what medications you want to get or don't get, or what medications the baby should get or not get. Then we talked about mental health and having some sessions during the pregnancy and after the pregnancy. And we talked about how you can take your support person or your partner, and how pregnancy mental health is different than talk therapy. And when someone tells you, oh, you should go get help when you're not pregnant, or you're having an issue, it's different in pregnancy with the perinatal mental health specialist. And it's becoming more and more important, and they don't have a lot of it's done virtually. It doesn't have to be around. If there's not someone available immediately around you, it doesn't have to be. And then we spoke about postpartum and having everything in place postpartum, whether it's from the pediatrician to disability forms and how you're going to go back to work, to looking out for signs of depression and blues, and most importantly, to have time for self-care and carving out time for yourself. And I guess original talk was about empowerment and advocacy, but as I was thinking of what I'm going to talk about and whether I'll do slides, I realized that just planning your pregnancy out carefully, whether you're low risk or high risk, is the best way to empower your pregnancy and advocate for yourself and having a more positive and successful experience. And whether you're high risk or low risk, all of these same topics apply.
Absolutely. Thank you so much, Dr. Rad. We appreciate so much having you here with us. This has just been incredibly enlightening and helpful. And so we really, really appreciate you being here today.
Thank you very much. I'm sure we went way over our time.
We did, but that is okay. We were the last thing today, so no one has anywhere else to be. So we really appreciate you, and just thank you so much again.
Okay, thank you, and thank you for the honor and for the time.
Yes, thank you.
And we look forward to working with you more, Katie, and working on the baby planner.
The same. I am so excited to be working with you. Thank you so much. All right, everyone. So I am going to spotlight myself here for just a second, and then we are going to sign off. But a few quick notes. One, I just want to kind of let you all know, listening to Dr. Rad's talk, you're already doing all of the right things, right? By being in this summit, by all that you have been learning today, you've got plans for so many of these things in place, and we have all of these resources for you. If you're using my planner, so much of what he talked about is in there. Also inside my of course the nested blueprint, and the part on getting partner support. We're really going to cover a lot tomorrow during my keynote. We also have a really great session tomorrow with Lo Mansfield, the labor mama, who is going to be talking to us about advocating for ourselves during childbirth and preparing for labor and delivery. So there are a lot of amazing resources to help support you through this coming up, and I am just so thankful to have you all here. Now, I know you have had a very, very long day. And I appreciate you so much and appreciate you being here. I have also heard your cries for, hey, it's been a really long day. Can we have a little more time to be able to complete bingo? Some of you have gotten it in and watched so many sessions, and I am in awe of you. But I hear the rest of you. And so we have extended the time for bingo. What you're going to need to do to win tonight's prizes, if you have not already submitted your bingo card, is just you've got until 8:30 p.m. Eastern to get that submitted. And then at 9 o'clock Eastern time, we're going to post in the Facebook group who won what prizes, and we will tag you in there. So go rest, breathe. If you're on the East Coast, eat some dinner, or maybe that's just me because I have young children. And we will be in touch with all of those awards tonight and giving away those fun prizes. And then we will see you back at noon tomorrow so you can sleep in. Our West Coasters don't have to be up so early. And we will kick off at noon tomorrow with a panel from Michelle Pratt of Safe in the Seat. That is an incredible, empowering panel, as well as a really great one that I'm super excited about from Dr. Samantha Radford from Evidence-Based Mommy. So we'll see you tomorrow for those. Thank you again to Dr. Rad. Thank you to all of you. Goodbye.